Stress is also coming under the modifiable, but again, in certain books, it has been mentioned under the non-modifiable. Again, in my personal view, it should come under modifiable, because stress is one thing which we can cope up either by the meditation. Just a simple example. During the time of the stress, if you are going to watch the television, if you are going to watch any movie, or if you are going to play this game in your mobile, for the time being, you are being kept, you can keep away yourself from the stress for the time being, not for the whole time, but at least for that time being, you can keep away your stress, and again, you'll feel better. But that is not a permanent solution for removing the stress, and it has got its own drawbacks as well. So, but then the thing is that stress could be modified. Then there's the figure which is showing the heterogeneity of the non-communicable risk factors in India. See, we have moved from the Kerala to that of Jammu Kashmir, from Nagaland, Bihar, Delhi. These all are having different states which are having different types of literacy rate, demographic factors, etc. Say, for example, Kerala is having high fertility rate, high literacy rate, developed state, while Delhi is metropolitan city, highly urbanized, heterogeneous population. So all are having different type of the population. They are also having different dietary pattern, different body composition, different habits. But then also they all are having more or less huge number of the cases of the non-communicable diseases. So apart from whatever the risk factor which I have stated, there are certain other risk factors which we are not knowing at present. Maybe in future we will know all those risk factors as well, which may be responsible for the non-communicable disease. Now, WHO, there is one thing in the control of the non-communicable disease, that is the surveillance, by which we are going to make the early diagnosis and treatment of the disease. And in the surveillance, what we are doing, we are going to, either do hospital-based surveillance or community-based surveillance. So in the community-based surveillance, what we used to do, we used to go house to house and then asking certain questions. So based on this, WHO stepwise approach has been adopted by most of the country. WHO has also recommended the same for the surveillance of the NCD risk factors, so that early intervention can take place in the community in order to control the non-communicable disease. And it's a simple step where we are going house to house, and in the step one, we are going to ask certain questions. So step one is assertive the verbal communication between the individual and the surveyor, while where we are going to ask certain behavioral risk factors, whether the patient is having or not, and then followed by the measurement, which is known as a step 2 or physical step, where we are going to measure his height, his weight, we are calculating the BMI. And then in the third step, what we are going to do, we are going to measure certain laboratory characteristics of the patient. So what we are going to do, we are either going to check the blood sugar, cholesterol level, and certain other parameters of the individual. So this is a step-by-step sequential approach to conduct the surveillance for the NCD risk factor in order to control the disease. Then what all are the different type of the NCD? There are plenty of different varieties of the NCDs exist, but the 4 main different type of the NCDs, which are mainly contributing, 80% of all the deaths are being contributed by these 4 different type of the NCDs. And among all these NCDs, cardiovascular disease is on top. So 4 different main type of the NCDs are cardiovascular disease, followed by the cancer, chronic respiratory disease, and then diabetes. And apart from this, there are other varieties of the NCDs, such as mental disorders. Mental disorders nowadays are most common cause of the morbidity, most common diseases or variety of non-communicable disease, which is creating the morbidity among the individual. So mental disorders, chronic kidney diseases, musculoskeletal disorders, sensory disorders, these all are the other type of NCDs which exist. So sensory disorders, which includes blindness, refractive error, etc. So coming on to the cardiovascular diseases are the group of diseases which are related with that of the heart and the vascular system, and the major conditions under this are ischemic heart disease or coronary heart disease. Then hypertension, cerebrovascular disease, which is also known as stroke, congenital heart disease, rheumatic heart disease. These all are the conditions which comes under the cardiovascular diseases. So among this, again, the important one is the coronary heart disease, which is characterized by the obstructive changes in the coronary circulation of to the heart. And the specific presentation in this is the myocardial infarction, not angina or sudden death. Most of the deaths have been reported within an hour, and sudden deaths have been reported within 24 hours of the acute symptom or sign. There are certain epidemiological indicators by which we use to measure the coronary heart disease, and these are proportional mortality ratio, loss of life expectancy, coronary heart disease incidence, age-specific death rate, prevalence rate, case fatality rate. Case fatality rate, in the case fatality rate, which is defined as a total number of the deaths out of all the cases for a particular disease multiplied by 100. So those fatality which have occurred within 28 days, means those deaths which have occurred within 28 days of the presentation, we are going to include in the numerator, in the measurement of the case fatality rate. So these are the ways by which we use to measure the coronary heart disease. And there are certain others such as medical care or measure of the risk factor levels. These are the ways by which we use to measure the coronary heart disease. These are the different ways which are defined under the epidemiological indicators. Then how the pattern of CHD is existing in India. The incidence in urban areas usually reported to be around 5 to 6%, while in rural area it is 1.5 to 2%. However, this figure is slowly increasing. Peak age group has been reported among the 50 to 60 years of age group. More commonly, it is reported among the males. Then hypertension, diabetes are constituting 40% of all the cases of the coronary heart disease. And smoking is the single most important etiological factor. Even in what we have observed while treating the patient, if patient is not going to quit smoking, medication also doesn't going to work. So that's why smoking, which is most important etiological factor, should be controlled by any mean on the patient who's suffering from the coronary heart disease. Then what all are the symptoms? There are different ways by which patient of coronary heart disease presents. Usually they are going to present in the emergency, but even in the OPD also sometimes it can be, or patient can be observed. So pain or discomfort in the center of the chest, then pain or discomfort in the arm, the left shoulder, elbow, jaw, or back. Difficulty in breathing or shortness of breath is also very important symptom in the coronary heart disease. Feeling sick or vomiting, feeling lightheaded or faint, and becoming pale. These all are the usual presenting feature of the coronary heart disease. And women are more likely to have the shortness of breath. Along with the nausea, vomiting, and back or jaw pain as compared to that of the male. Apart from this, sometimes patient might not present even a single feature, but then also he is suffering from the coronary heart disease. So it can be presented in asymptomatic form as well. So how we are going to prevent CHD? The prevention is mainly made in or divided into the population strategy in terms of primary prevention, where we are going to advise to the whole population, and then primordial prevention into the whole population. So this is the primary prevention, while in the secondary, then in the primary prevention, we can also conduct primary prevention in terms of the high risk strategy, those who are having great chance of suffering from the coronary heart disease. And then we can go for the secondary prevention, where we are going to conduct any kind of the screening test for early detection and treatment of the disease. So population strategy, there are certain specific intervention where we are going to advise in terms of dietary changes. And in the dietary changes, we used to advise reduced fat intake. We used to advise you should consume less amount of the oil, and the fat total energy, total calorie intake should be constituted only to 20 to 30% by the fat per day. Then saturated fat, that should constitute less than 10% of the total energy consumption. Reduction of the dietary cholesterol should be restricted to less than 100 milligram per 1000 kilocalorie. And we should always advise to the individual that you should consume complex carbohydrate. Complex carbohydrate in terms of that you should consume different flours, not single flour or wheat flour should be consumed by you, but different types of the flour should be consumed. Then avoid alcohol consumption, avoid smoking as well, and salt intake should be restricted to the less than 5 gram in a day. Though it is very easy, I can also understand that it is very easy to say you have to do this. But once you will practice yourself, or patient is going to practice himself, he will complain a lot of things in front of you. Doctor, I'm not able to, quit smoking, I'm not able to quit alcohol. But then it all depends upon your technique, how you are going to tackle the patient. You can say that when you have started consuming alcohol, that was the first time. Now, if you are going to keep your will to leave this alcohol consumption at once, you can do. There are plenty of ways. You can also, advise him for the meditation. You can advise him for exercise. You can advise him that there are certain video clips which you can observe, and where different ways of quitting smoking and alcohol has been taught. So you can adopt, all those. Smoking is single most effective intervention, not only in primary prevention, but in secondary prevention as well. Blood pressure, prudent diet can be mainly involving the reduced salt intake and avoidance of the high alcohol intake, regular exercise, that is under the prudent diet, which can also control the blood pressure and hence coronary heart disease. Physical activities, again, important one. Primordial prevention, where preventing the emergence of risk factor is going to reduce the chance of occurrence of coronary heart disease. In the high risk strategy, what we used to do, we used to identify a specific case who is had high risk, such as obese person. So we are giving the specific advice accordingly, depending upon what type of risk he's having. In the secondary prevention, or as I told you, cessation of smoking. Smoking, if person continues to smoke, even the drugs or medication is also not going to work. So this is the single most effective intervention in secondary prevention as well. Then control of hypertension by varieties of drugs such as beta blocker, ACE inhibitor, HMG coenzyme reductase inhibitor, calcium channel blockers, control of diabetes. These all are the ways which can be adopted in the secondary prevention for the occurrence of the coronary heart disease. Then revascularization procedures of the patient who are suffering from the angina, bypass can be done, which will come under the secondary prevention for the management of the coronary heart disease. Then second one is the stroke. The stroke is defined as a dysfunction of the brain. If it is going to last for more than 24 hours, we used to say this is a stroke or cerebrovascular disease. And if it is existing for less than 24 hours, we used to say this is a TIA, that is transient ischemic attack. The disturbance of the cerebral function is usually caused by the three morphological abnormalities. That is either because of the stenosis or occlusion, complete occlusion, or rupture of the artery, which is giving rise to the hemorrhage. And as a result of these three different types of the morphological abnormalities, two different types of the syndromes can be produced. One is ischemic stroke, which could include the conditions such as lunar infarct, and this ischemic stroke is because of the either stenosis or because of the occlusion. And this can produce the conditions such as lunar infarct, carotid circulation obstruction, vertebrobasilar obstruction. While the one which is caused as a result of the rupture of the blood vessel or hemorrhage, it can give rise to conditions such as spontaneous intracerebral hemorrhage, subarachnoid hemorrhage, intracranial aneurysm, or arteriovenous malformation. Now, what are the features of the stroke? The most common presentation of the stroke is the hemiplegia. This is the most common form of presentation. Our patient can also present itself in the form of paraplegia, monoplegia, multiple paralysis, coma, or he can also present himself with the speech disturbances. He can also present in the form of nerve paresis or sensory impairment, where he's unable to feel sensation. Then coming on to the cancer, which is another variety of the non-communicable disease, where now the clinical feature of the cancer will depend upon the site and the extent which has been involved by the cancer. So the oral cancer might be having presentation of not able to open his mouth or abnormal bleeding from the mouth, and cervical is having their own clinical presentation. Similarly, breast and prostate are having their own presentation. Breast might present in the form of lump, while prostate cancer patient will present frequent urination, or he will feel the urination, but he's not able to pass it completely. So we used to advise him for the laboratory investigation in order to confirm the diagnosis. And similarly, in the lung, abnormal bleeding, oral bleeding can take place, or shortness of the breath can take place, which could not be relieved by the medication. So different clinical feature could be there depending upon the site of origin of the cancer. And the danger signals could be lump breast, could be change in wall, swelling sore, which is not getting better, persistent change in the bowel habits, persistent cough, excessive blood loss, or unexplained weight loss. These could be the danger signals of the cancers. Now, coming on to the diabetes, diabetes is also one of the most important non-communicable disease, where a patient might present as feeling more thirsty than usual, urinating often, and losing weight without trying. Nowadays, in the OPD, we are seeing this one as the most common feature. The people where we are working, usually it's a rural area, it is totally a underdeveloped area. Patients are very commonly presenting with, Dr. I am having loss of weight, although I'm not doing any exercise or I'm not trying to reduce the weight. And also, along with this, I'm feeling lethargic. This is the very common presentation nowadays in terms of making diagnosis for the diabetes. So we used to immediately, advise all of them for the blood sugar check. So diabetes is a condition where we used to say that if the fasting blood sugar is greater than 126 milligram per deciliter, or postprandial greater than 200, or even random also greater than 200 milligram per deciliter, then we used to define this condition as diabetes. So these are the features by which usually a patient of diabetes presents. He can also present in the form of ketones in the urine, or smell in the urine, and feeling irritable, or having other mood changes, having blurry visions, frequent change of the number of glasses, specs, and then having slow healing sores, getting a lot of infection. Recently also, just 2 days back, patient has come to me that and complained that she's having multiple small pustular nodules, but she was not having any fever. She's only having pustular nodules, small, all over the body. And she said that I took antibiotic myself, but even then I have not been relieved. Then immediately I thought that she might be suffering from the diabetes. I immediately tell her to go for the blood sugar checking, and I found that yes, I was correct. She was suffering from the diabetes. And as soon as the diabetes or blood sugar has been controlled, I feel that these nodules will automatically be controlled. Then another disease which is nowadays becoming kind of the pandemic, and we are concerned mainly that obesity, which was earlier mainly reported among the middle-aged people, these are being reported nowadays, especially among the children, and that is an area of concern for all the public health individuals or professionals. So what is obesity? Obesity is in fact nothing but increase either in numbers or in size of the fat cells in the body. That is defined as obesity, which can be measured by different ways. We can measure simply just by the BMI. We can also measure by the Broca's index. We can also measure by certain other formulas such as Ponderel index or Lorentz formula, etc. But BMI is the simplest and commonest way of measuring or finding out the obesity, where it has been said that if this BMI is defined as a body mass index, which is being calculated by weight in kilogram upon height in meter per square. So if any individual who is having a BMI of 30 equal to 30 or greater than 30 kilogram per meter square, then he will be defined as obese. And we will define as overweight if he is having a BMI of equal to or more than 25, but less than 30 kilogram per meter square. So if person is suffering from the obesity, then definitely he is at high risk of developing other varieties of the non-communicable disease. And for children under 5 years of age group, weight for height is being taken as a criteria from the WHO child growth standard. If he's having greater than 2 standard deviation figures, then we will define him as under the overweight. And if he is having greater than 3 standard deviation figures, then we will define from the median, then we will define him as a obese. So what we used to do in the obesity, that I will again come in subsequent slides. But yes, definitely, I mean, the treatment or the prevention strategy for all these diseases which I mentioned, that is common, which I will cover in the subsequent slide. Blindness is also nowadays, again, earlier also this was quite common, but nowadays, time to time, certain changes in the criteria for defining the visual acuity of blindness has been made by Government of India as well as WHO. So nowadays, we used to define the visual impairment into 2 different categories, that is presenting with the distance visual acuity and presenting with the near visual acuity. So in the distance visual acuity, there are 4 different categories for defining the visual impairment. That is the mild impairment, where the visual acuity is worse than 6/12, moderate visual acuity, where visual acuity is worse than 6/18, similarly severe 6/60, and blindness we are defining if the person is having visual acuity worse than 3/60, even after all type of efforts have been done for the correction of the visual acuity. While for the near vision, it has been said that impairment is there if the n/6 person is not being able to read n/6 at 40 centimeter with the existing correction. Globally, it has been estimated for the blindness that approximately 2.2 billion people live with some form of the distant or near vision impairment. With regard to the distant vision, 36 million people have been reported to be blind. And the important thing regarding the blindness is that 80% of the blindness is avoidable. We can avoid by either treating the disease or potentially treatable diseases are there, which by which we can avoid this type of the blindness. And that's why the government as well as WHO, other international agencies are stressing on to the avoidable type of the blindness. We are mainly focusing on avoidable type of blindness. The causes of the moderate to severe vision are as follows. Uncorrected refractive error is constituting 53% of the severe vision. Then cataract is responsible for 25% of the severe vision loss and glaucoma 2%. While if we will see the figures for the blindness in the world, then unoperated cataract is responsible for 35% of the blindness, while uncorrected refractive error is responsible for 21% of the blindness, and glaucoma at present is constituting 8% of the total cause of the blindness worldwide. While in India, the problem with the visual acuity is most commonly presented by the untreated cataract, which is equivalent to 66.2% at present.